Hi guys, just wanted to do a quick video as last night the UK went into our third national lockdown and it's quite overwhelming, I think, for a variety of reasons. And for people who experience anxiety, for people who experience health anxiety as well, or any kinds of anxiety, but health anxiety as well, having, you know, deaths high, cases high, stories constantly in our news feeds, in our faces, on the news. It's incredibly anxiety inducing and overwhelming, and I just wanted to do a quick video just talking about some things that I do to help with the anxiety and to emphasise that it's completely valid to feel overwhelmed and anxious right now and to not suppress that feeling, but just try and acknowledge that anxiety is there. So I feel like ever since I've started this pandemic, I've been in two conflicting modes that I've almost got to choose one or the other, and that's been wrestling with one side of me feeling that we need to be in a lockdown, we need to get rid of this virus, people are dying, cases are high, I don't want to spread this virus to anybody, I don't want to get this virus again. Another story, another video. The NHS is overwhelmed, healthcare is overwhelmed, and things feel really stressed, and wrestling with that. And then, you know, why are people socialising? Why are people still seeing people? And wrestling with that, mixed with things have to get back to normal, and being sad about being in a lockdown, and being sad that I'm not going to hug my friends or see my partner. You know, all of these other things that, you know, I'm not going to see family members, and we can't go do normal things that we would normally do. Our life has changed. So wrestling with that annoyance. And I almost felt like at one point I chose that, and then I chose to go to this side for a bit when cases were dropping and we went into the tier system. And then I switched back over there recently. And I think it's just in the last few days that I realised it's completely valid to be annoyed and pissed at being in lockdown, but also agree that we should be in a lockdown and that that's helping people, that's saving lives. And I think that's completely valid, and I think we've sort of put these two camps of which are you? Are you an anti-masker or whatever? But I think it's completely valid to feel both. You can be annoyed at the situation and still understand why we're here and why we've got to stay at home right now. I think something that's really important right now is self-care, and it sounds really obvious, but I think during the first lockdown, when I look back now, understanding that health anxiety is really illogical, and that's what it is. When I get health anxiety, I'm illogical, and I'm aware that I'm being illogical. I'm aware that there's a 2% of chance of getting something, or I'm aware that some sort of disease has, you know, a tiny chance of me getting it really bad. But I'll still focus on that tiny illogical percentage. And when this is in the news and in our faces, on the social media and everything right now, I still do that. I still focus on that small percentage. And I think during the first lockdown, all I was doing constantly was focusing on, you know, do I have this? Do I have a cough? Even though I haven't been anywhere, you know, could it all the different ways? Like, could it have come over through the post? I kept hearing stories on my Instagram. There's just people like in bed, like coughing, saying that, you know, oh, I've not been anywhere. But I've just got deliveries and I've got it. And I was like, oh my god, this is so overwhelming. And I think I've really realised that that's so unhealthy to do, and I almost became completely obsessed, like similar to, if you've seen my other health anxiety video, going through a phase. It was similar to going through a phase, and, you know, what happens if you're in your 20s, but you do have this, and it's a new disease, and, you know, there is people, even though it's unlikely, there is people in their 20s who have had it bad. And not even that, I think it's also worrying about my parents and worrying about family members and friends' parents and friends' families and my friends from getting this virus. And I think constantly going, if I get it, what does that mean, and what's the next thing? All these thoughts are so overwhelming. They really are. Like, I'm so overwhelmed by my own thoughts when I'm watching Boris on TV, or I'm watching some medical expert go through all the numbers and the facts and the numbers and the deaths, and it's so overwhelming. And I think this lockdown, it's really important to limit that time that you're spending looking through social media, watching the news. And if you suffer from anxiety, and health anxiety specifically, but any anxiety, because this pandemic probably needs its own name of anxiety that's being created, because it's obviously health anxiety if you suffer from health anxiety in the past. This is, you know, the news is in your face all the time. This has never happened before, but medical news is in your face. And I find it very overwhelming when I hear that cancer treatments, for example, I saw an article yesterday that cancer treatments in London are being stopped. And I was very anxious all night after I read that. And I was Googling, you know, what would happen if this, and not realising that I am okay. I don't need to have any procedures done right now. And accepting that the response should be that I'm sad for the people who can't get them right now. But obviously that anxiety is, what if this happens and this happens that results in this? But to eliminate me even get into that thought process and me Googling, what if this happens and this happens and this happens, will I get that? Or will my mum or my dad or my friend? I think to eliminate that, you have to eliminate the time you're spending researching. I think that's a really important thing. So I think maybe limit yourself to just watching news every other day or a certain amount of time on social media. I've unfollowed all the news merchants. I've unfollowed all the news people, the newspaper companies who are on my timeline, because the comments were just awful as well, because it was just people going backwards and forwards, you know, oh, it's a conspiracy, and then on the opposite side it's like, you know, someone saying my grandma just died last week, and that's so overwhelming to read because it brings it so home. It's important to read and it's important to know what's going on right now and not shutting our eyes and going everything's okay, because it's definitely not okay, but accepting that we're okay. And I think even I've been, so I'm home with my parents now, I've had 2 tests, so long story short, but I did test positive a month ago for coronavirus, and I'm going to do a different video about it, but it was very anxiety inducing. I had no symptoms, and I didn't spread it to anybody directly, but I didn't go anywhere, obviously I self-isolated, so hopefully I didn't spread it to anybody, and anyone who I came into contact with all came back negative, so very bizarre. My partner had symptoms, but also we had a test and came back negative. I'll do a whole thing talking about that, but I basically then, over Christmas, spent time self-isolated. Before that, it was Christmas, and then I went home for Christmas to see my parents, and I've stayed home now. And even though I had a negative test result last week, even though I'm pretty sure that there's some sort of antibodies that mean that I can't get the virus so soon, or maybe it wouldn't. I don't really know how it works. I don't think anybody really knows, but I think it's less likely, technically. Tell me if I'm wrong, actually. I'm really interested in this. Do I have some sort of little bit of immunity for a little bit, just for my own peace of mind? Please comment below if I do, because I'm obviously doing everything as normal. I'm locked down, I'm staying at home with my parents, I'm not going anywhere but for walks, but it'd be nice to know that I have like a little bit of a immunity. But anyway, I had a test last week, and then I've had 2 tests since, and I've had 2 tests since then, all negative, since I tested positive. Yeah, I'm still anxious that somehow, you know, I ordered some clothes, and then I really enjoyed ordering the clothes, but then I was like, have I somehow, you know, and then I was going to go to McDonald's today, and I was like, oh, I'd love McDonald's. It's been like 2 months, but is that risky to do that? Even though I know it can't even spread through food, I don't think. I think this is the problem as well. So I think right now, with health anxiety, for me personally, obviously everybody's anxiety is different, but for me, the anxiety comes from the unknown I get the anxiety when I know something's wrong, or I've got a symptom and something feels off, but it's not been diagnosed, and I jump to the worst case scenario. So with coronavirus, because so much isn't known and there's so much blurred lines, the anxiety is so much more heightened, and it's really hard to get actual facts, even from, you know, the NHS website, because it was so funny, because when I actually tested positive, my window is 10 days, and then I think the windows of my contacts was 14 days, but it changed to 10. Very strange. But then my parents were like, but other countries say you're contagious for 30 days. And another country said 21 days. So it's so hard to get actual factual information, and that again raises your anxiety and raises your time on social media and on the news and on Google Google, researching all the time, you know, what is my risk of this? What would happen if I got the virus and this happened, or what was it this, but I got the virus and there's so much anxiety going on right now. So yeah, I just wanted to do this video just to quickly say, and I've rambled on a lot, take some self-care, you know. I've really been trying to focus on that and try and take your mind on other things and limit your time when you're focusing on this. If you're at home and you're not going anywhere, you know, we're even getting like an online shop just for that extra bit of safety. So we're doing everything we can. We're even wearing masks in the house just for the next few weeks, obviously, until it's been a full 2 weeks since I've come back home. But yeah, I'm taking them precautions, and I need to sit with that I'm okay, and that my parents are okay. And it's hard to do that because there is uncertainty, and that's hard. And there is going to be anxiety, and I'm going to feel that anxiety some nights in this lockdown. And there's other things that are hard with this lockdown. We're not going to see people that we love. We're not going to be able to do normal things that we normally do. Our lives are different. Careers have been shifted, changed. So many of my friends are out of work right now. Universities have been really fucked over. I'm doing my masters at drama school at the moment, and we were supposed to finish in December. Now we're finishing in March. And then we were finishing in February, but now we're going back at the end of February. But then everyone's like, some people have got plans after February now, or some people have got accommodation that runs out. So yeah, there's so much going on. There's so much anxiety and self-care. So at the moment I'm learning the piano, which I'm really enjoying. I do music, so if you want to check out any of my music, it's just John Thacker, or China Moon is my band on Apple Music or Spotify. And just throwing myself into my music. I'm loving learning the piano. I'm using an app called Simply Piano. I'm not endorsing that. I have no followers, but Simply Piano is great. I've really enjoyed it. And you also get Simply the guitar. So I kind of already play the guitar a bit, but I've just been enjoying like fiddling a bit with it, because this year I've been quite redundant with it all. Just that, reading some books that I've always wanted to read. I did love the first lockdown for the sense that I got time to do things that I've always wanted to do and I never have time to do. I wrote a book, which was crazy. I've never wrote anything like that in my entire life. I did stuff that I've always wanted to do, and there's still always stuff. I'm a creative person that I want to do. So find things that you want to do, you know. My partner loves cooking, so maybe like get into cooking more, learn something new, keep interacting with your friends, self-care, bath, enjoy just time with yourself for a little bit as well. You know, I've got the Calm app. I'm not endorsing this either, but I listen to the Calm app when I'm feeling stressed, and that really helps reduce my anxiety. Yeah, I hope that helped. Probably, I don't know, yeah. I hope that helped. It probably could have been shortened into like a little 1 minute clip, just going, you know, do some self-care and limit your social media time, limit your news time. But yeah, I think it's really important, and I hope this helps in some way if you're watching this video. Please check out my music, and feel free to follow me on Instagram if you have any questions about health anxiety. I'll just drop me a DM. Thanks for watching, and please subscribe.